Maryland Municipal League is the Association of Cities and Towns for the state of Maryland. We advocate on behalf of all the cities and towns, and we enhance government structure in Maryland, the municipal government structure, by educating our municipal officials.
This week we're holding our annual fall conference. We're having it here in the vibrant city of Rockville, Maryland. The purpose of the conference is that we, as a league, we have legislative priorities that we like to get in order and to coordinate our efforts for the legislative priorities that we're going to be representing or presenting to our state legislatures in Annapolis when the session begins in January.
Highway user revenues has been a MML issue since they were basically depleted on the municipal side back in 2009, 2010. 72 years ago was the beginning of the contract that the municipalities had with the state of Maryland. And the contract said the state's going to collect gas tax, the state's going to collect vehicle registration money from all over the state of Maryland. And some of that money is going to be shared with the municipalities. Yes, the state roads are very important. The state highway system is very important. Mass transit is very important. And yes, it gets under the formula the lion's share of that money, but a measly 30% of all of that money before was shared with cities and towns and the counties. After the recession hit, the state said, we need that money to do our work, and we were good soldiers, good team players. The municipality said, you know what? We're all facing tough times. We're all going to have to tighten our belt and live through this. We did that. We're still doing it. Our contract with the state has sort of evaporated. We no longer get that money to the same amount that we got back in the in 70 years ago. So highway user revenues, the sharing of that money needs to come back to the cities and towns of Maryland.
Specifically for my municipality, which is the town of Newmarket, Maryland, just east of Frederick, Maryland, there we have flooding that comes off of our alleys in our historic district, and that flooding is going into our residents' yards and causing problems. We'd like to put in stormwater infrastructure in those alleys, and unfortunately we've had to postpone that project due to having insufficient funds coming in.
This is our money, and it needs to be returned to us.
It's now been 8 long years since that fateful day back in August of 2009 when local governments lost 96% of their highway user revenues with no discussion, no advance notice, and no ability to replace the monies that were eliminated from our budgets in the first month of a new fiscal year. Since that time, MML has been working diligently to recover our transportation monies, and we have been successful in recovering at least a portion of municipal HURs in all but one fiscal year since the monies were first diverted in 2009. In fact, because MML and our membership were able to convey to the administration and the General Assembly over the years that municipalities desperately need this funding, there has been an additional infusion of $90.4 million for municipalities in the last 4 state budgets, which in FY 2018 will provide close to 60% of the pre-recession municipal HUR funding. That's the good news. But the bad news is that in total, municipalities still have lost $265 million over the past 8 years with no repayment offered by the state. During the previous 2 General Assembly sessions, MML requested legislation to address our ongoing loss of these transportation monies, and last session, MML introduced 2 bills to restore municipal HURs to pre-recession levels. Although the bills did receive a positive response from many members of the General Assembly, in the end, because there was no agreement reached between the House and the Senate on the passage of this legislation, neither bill moved out of committee. When discussing potential legislative priorities this year, the members of the MML Legislative Committee felt very strongly that the League must continue to vigorously advocate for the return of municipal HUR funding during the upcoming legislative session. During discussions on the issue, the committee reiterated our position: we cannot continue to exist on one-time grants and single-year allocations. Because these grants are discretionary and not predictable, they do not allow municipalities to plan and budget effectively on a long-term basis for routine, ongoing road maintenance and infrastructure projects. As a result, the committee voted unanimously to again recommend the restoration of municipal highway user revenues with an emphasis on securing a commitment from the General Assembly and the administration to return to a stable, predictable, long-term municipal road funding formula as one of 3 priorities. To accomplish this, it's important that we all speak together as one to make sure our voices are heard loud and clear. We think this is simply a matter of fairness. The state legislature and the state government stripped that important road money from municipal budgets some years ago and simply hasn't fully restored it. And so we're stuck in a bind having to provide the services for road maintenance and road construction for our residents and our businesses without the proper resources that we're supposed to be getting from the state.
What kind of ripple effects has that had for your community and other programs?
Well, municipalities are the level of government closest to the people. You hear that a lot, but it's really true. We, as municipal leaders, bump into our constituents in the supermarket or at the gym, and they want to know how we're taking care of them and how we're providing the services and amenities that they need for a decent quality of life in Maryland, which goes to economic development, it goes to social services, it goes to all of that. And if we can't provide good quality road maintenance and transportation infrastructure, we're going to have a disadvantage relative to other states and other entities. So we really need to have those resources. Our constituents feel it every day when they're driving over potholes or they can't get across a bridge because the bridge isn't there because it's never been built. That's a real problem.
The loss of the revenue really came at the worst time because the recession also gave us a double whammy, if you will. We had very little money to really draw from our own coffers, and then the highway user cuts at the same time gave us the opportunity to try to decide which priorities were first. Should we work on the roads? Should we develop salaries for staff? We had to really pull money down from our capital in order to make sure that our roads were still safe and still in some good condition for people to travel. It was not a good time for us back in 2009, 2010, but we struggled through. But now it's time for that money to be returned because we still have those needs to make our roads safe as well as secure for our community.
Well, I come from a relatively small town, the city of Brunswick, which is a population of about 6,000. We're in the process of growing to 12,000, and it's affected us quite substantially. It's made our ability to resurface a lot of our roads harder, and because of that, if we take money and fund it towards roads, we take it away from other things, other infrastructure projects such as water lines and things like that. So it's affecting our community in a great deal. We're hoping that we can restore full highway user revenue this year, and we're going to work with the legislators this year to hopefully achieve that.
My town is Denton, which is on the eastern shore, and we're about a town of 4,500 in Caroline County. So we are already disadvantaged income-wise in terms of our town and our budget. But with the HURs, our problem is we literally have dirt roads. We're the county seat, and some of our roads have now gone to dirt. So it's very problematic, and we have no other mechanism or budget to fix these roads. So as other people have said, we continue to stall projects, put off projects. Our public works departments have gotten very creative in making sure we patch the roads, but at some point the projects are becoming more and more expensive and repair isn't feasible. And we also have from our community, there's a lack of understanding of HURs, so we're trying to get that information out there. It's imperative that we get the state funding back because small municipalities, although we're not big in size, we have the same issues. And again, we're the county seat and we have dirt roads.
we have to move money from other projects and priorities in the city of Frederick in order to fix our roads, then there's other critical services that we're not able to provide to the full extent of our residents' expectations.
HUR is necessary for us in our community. We need the funds restored back into our communities. HUR causes us to become creative, to fix our roads within our own community. We have so many different vehicles that come up and down our roads, whereas it causes potholes, cracks, so on and so forth. So when we don't have those funds come to our community, we have to pull them from different grants and other resources. So when we get those resources from the state, then we know that we're going to have those funds. And then we can budget our money in other places, other proper places. So to get those funds consistently, it would be a great impact on our town. So that's what we're really fighting for. We're fighting for that restoration. It causes our towns and our budgets to be in a good place. We have to now drain our budgets. I live in a small town, a small community, where grants are very important to us. So if we can use our grants towards other resources as opposed to trying to fix our streets and know that we can get those resources from our state, then we can go ahead and use our grants for other resources. So if we could get those funds restored, it would be absolutely wonderful. Our community at times doesn't understand where we get those funds to repair our roads. So they're kind of tough on us, you know. It's, let's repair this crack. Why can't you repair this crack? Why can't you repair this road? But it's because we don't have those financial resources. So it really, really does cause us to have to be creative. So we're doing that, we're making it happen, but if we receive those funds, it would cause us to have a smoother ride.
It means that we've had to fully fund our streets and sidewalks and our bike programs from town revenues, which comes from our property taxes. It means that as we lose revenue from reductions in highway user revenue, and that coming from the state, we have to make up that difference from town tax revenues, which means it comes out of everybody's wallet in the town.
Mount Rainier used to get over 260-some thousand a year. We are now down to less than 50,000 a year. You can imagine that we're not doing roads. You could imagine we're not doing alleys or gutters. As a result, we have a lot of road issues. One of the biggest complaints I get from my citizens is, when are you going to repair roads? How are you going to repair the roads? My choices are get the money from the state and keep fighting to do that, or raise my taxes so folks won't be able to live in my community. Roads are critical for transportation. We consider ourselves actually a real transportation area, because not only do we have bikes and buses and cars, but we have lots of foot traffic. We need sidewalks. Some of our sidewalks have not been repaired. Some of the trees in my community have raised the sidewalks in such a way that they are safety hazards. They're trip hazards. They're in front of the schools. They're in front of the churches. They're everywhere you can think of. And without those HERS or the HURs, it's impossible to do the work necessary to make my residents and my city safe. And so, how important are they? Very.
Back when we had full HURs, we had one of our residential streets called Walnut Street, and that street was a mess. No curbs, potholes everywhere. And the last major street project we had was Walnut Street, and you should see it now. It's beautiful. But HURs are certainly a hot button issue for small towns. I'm president of the Eastern Shore chapter of MML, and we represent over a third of the municipalities in Maryland. And we're all facing the same thing. We've been very short on highway user revenues for the past 5 or 6 years, and state roads are getting in great shape thanks to the governor, but once you pull off a state road into a city road or a town road, you find they're in complete disrepair. We need those highway user revenues brought back up to date so we can bring them up to date with the quality of the state roads.
The HURs have a significant impact on my community in the city of Greenbelt. We need that money in order to maintain our infrastructure. We've used HUR funding to pave and maintain several municipal streets in Greenbelt. And, it's not just people from Greenbelt who use our streets. It's people from all over. So we need that money, which should be and is earmarked, for transportation. We need to use that to maintain the streets and highways, the municipal streets that everybody uses. So it's a big deal for us, and to have it cut so radically, we've been successful in getting bits and pieces of the funding back through grants, but we need certainty in order to kind of budget for the for the future. We need predictability. We need to know that the money is going to be there, and we need to know how much. So we've been struggling with the state to try and restore the highway user revenues back to the previous level. And we made some headway, but what we really want is we need a formula. We need some way of actually knowing the money is going to be there so that we can maintain our infrastructure and streets the way that they need to be maintained.
Losing the highway user revenue has been a significant challenge for our city. We have millions of dollars in projects that we're unable to complete because we do not have the benefit of this money that our taxpayers are paying into with the gas tax, but it's not coming back in its fair share to our community in the city of Frederick.
The HUR, we can't do the projects that we need to do every year. We have to prioritize them, and some of our streets are in good shape. We try to keep up with them the best we can. We do a lot of our work ourselves. We patch them, and we got a real good crew that works on them, but we can't do them the right way. We can't get them up to grade because we have to watch our budget. We can't, if we could get the HUR fully funded again like it would be, then we could get almost all of our streets up in town.
The restoration of highway user revenues is an impact to no matter what size your city. Rockville's a little bit bigger, and so we have actually been able to absorb some of the cost, but other things have gone undone because we've had to do that. It is imperative that we get the restoration back for all of us. It's the citizens' money to begin with, so returning that money would be the right thing to do, and then we can continue to build our sidewalks and pave our streets and do all the things that we do with that money for the benefit of the community of Rockville. What we've done is we've put our sidewalk and street restoration on a slower schedule. Instead of every 10 years for streets, we've repaved every 12 to 15, which has caused some consternation among the community because the potholes get bigger and bigger and things like that, which then damages cars. But we have tried to work with the money that we've been getting back and to make progress in ways that we can. We have a Safe Walks to School program, so we are concentrating on those sidewalks that take children to and from schools and parks, and some of our other neighborhoods have waited a little bit longer than they should have because we've been doing so much with it on just making sure that the children are safe.
Impact, it takes away from our revenue at the end of the day, but we're trying our best to stay strong. We realize that it's something that needs to be addressed. It should be addressed. Unfortunately, it's not been addressed to the level that everybody wants to, but at this stage, we're not holding our breath.
My streets in my town are in very poor condition, and that money is a huge help to us in our community. And it's been lacking for the last 9 years, and the governor has been promising to get that money back restored to the full amount that we used to get 9 years ago. So that's the biggest issue that my town's facing right now, and I think that pretty much all the small towns is facing that same issue. Oh, it's a huge impact. The people, riding down our streets, if you go to our industrial park, they're riding down really the bad streets of town to try to get to we want to show property in our industrial park. They got to ride down these same roads, and it's disgusting. It makes it look bad for your town.
It needs to be brought back. It's imperative to have safe streets for our community. We do have an elementary school. We have children, elderly. I would really appreciate it if we could get this issue resolved quickly.
It's put a crimp in our budget, to say the least. The city of Frederick was getting approximately $3 million a year for HUR. In 2009, that's what we got. In 2010, our payment was $290,000. So over the time period, we have lost about $10 million worth of HUR. And so what that does is we need to allocate those funds from the general fund. And that makes it almost impossible for us to be able to do the things we need to do with our maintenance for highways and sidewalks and curb and gutter. So we're falling behind. And on top of that, we're allocating money to try to keep up a little bit, which takes out of the general fund, which takes it away from things that we need to be able to do on a regular basis.
What does that mean for citizens and for economic development?
You know, some of the things that we'd like to be able to do to promote economic development, to do some extra projects that we had planned that we had to move allocations for, we can't do them, or we have to delay them by years, and by that time the cost to do those projects have gone up. Same with the maintenance on the highways. You know, we've been allocating funds for that to the best of our ability, but if we keep pushing it off, we keep pushing off, and ends up being more costly down the road.
Since 2009, we had a 90% cut in our revenue. We went from about $430-some thousand to about $10,000. So as you can imagine, in our budget, that was a drastic cut. That's pushed our public works program for road reconstruction and milling and overlay back about 7 or 8 years. And now we're doing maybe one road a year, where we were probably able to do at least 2 with that amount of money had it accumulated over the years. So it's been devastating to a small town like us.
Well, it's meant a lot for us. What we used to receive, $130,000 as a small town, we get probably maybe $19,000 a year. And that just doesn't do a road. It's hard to even do it with the 130. We are in a high priority area for funding, and even with grant expectations, it's very competitive. So we don't get the funds we need to do the roads that we should do. We don't want to burden our residents by raising taxes for this. So in some ways, we forego some road improvements that we need to have done.
What's it like to drive on the city streets in your town?
Well, you've got potholes that maintenance can take care of, but the overall infrastructure, in particular, we have a highway that comes through our community that is in deep need of repair that we can't afford to do. It takes commuter traffic because of being a highway. So that's one of the big issues, is that road itself. It's going to take more than our town could afford to do in the next 5 or 6 years.
We went from about $95,000 income for that to about $5,000 when we were first impacted. So it's been a tremendous effect on us. Snow removal alone is about $20,000 to $30,000 every year. So, you know, we've had to push back projects and redoing a number of streets in town. So just glad that the governor's back on track with it, and look forward to full implementation.
Sidewalks are very important to us as well. We have a lot of children that are on the bus stops in the mornings and in the afternoon, so we do have to go after grants for our sidewalks as well. Some of the sidewalks that we have are cracked and they need repaired, so we need sidewalks repaired and we need sidewalks installed. So that's really, really important to a lot of our parents. A lot of times when the children are getting home from school, they have to walk actually in the street. So if you're talking about cars driving in the street, and if the cars have to swerve from the potholes that are in the street, then you're talking about children and also adults that are at risk. So sidewalks are very important as well.
Thank you so much. That was great.
We have been really focused on transportation and on local roads and state roads, and trying to work together with you and getting your input on the state roads that we're doing. We have $9 billion worth of state roads currently under construction, 1,000 projects from one end of the state to the other. It's unprecedented, and we've been fighting as hard as we possibly can for 3 years to fully restore HURs to their original historic highs after 90% were cut. Right before I became governor. It's something that we have not been successful in restoring all the money. We did get everybody some money. It was cut in half by the legislature. But we're really going to need to work together with you and with MACO and everybody pushing together this session, because we're going to keep pushing for it. And we need some more muscle to try to make sure we can convince legislators that your roads are important. That's money. It's the biggest source of revenue from the state to the local governments historically, and it's putting a real cramp, I know, on your municipal budgets by not having those revenues from the state. So we're going to keep fighting hard to do that.
The governor mentioned that, and I look forward to working with him on this particular source of funding for you. It's the best possible return on investment for the state that we have. really. Because if you guys don't have the resources to fix the potholes, everything starts to wobble and gets destabilized. So thank you guys for being a good advocate on that.
That was a travesty years ago when the legislature took almost 100% of the highway user revenues. Why is that a travesty? This money is very well spent. It gets a great return on investment. We never should have taken it in the legislature back then. It's been a devil of a time getting it restored, but I'm glad to see that Governor Hogan is moving to increase the allocation. And to the extent it gets back to where it was accustomed, I would be a very happy comptroller, because this is a small amount of money with a big return.
I'm pleased to bring you the second priority issue recommended by the MML Legislative Committee. Recently, there has been a significant increase in the number of vendors requesting personal and work email addresses and telephone numbers maintained by local governments and state agencies. As you well know, municipalities often maintain email lists to distribute city and town newsletters, recreation and licensing materials, public work updates, emergency alert information, and other such informations. These are typically lists that are comprised of personal email addresses and phone numbers provided by residents who have asked to be subscribed to these lists. The Maryland Public Information Act, or PIA, is intended to provide Maryland residents with broad access to public records while protecting legitimate government interests and private rights of individual citizens. Legislation has been introduced and passed in previous 3 legislative sessions to address various aspects of the PIA, including a very broad and comprehensive rewrite of the law in 2015. However, despite considerable legislation over the past several years, current law does not provide clear authority to the state or local governments to deny requests of this nature asking for personal information. If adopted as a priority issue by you, the members of MML membership, the League would partner with other interested stakeholders during the 2018 legislation session to request legislation which would provide municipal officials with clear authority to deny requests that include the release of email addresses and phone numbers for residents who have voluntarily subscribed to various municipal email lists. The legislation would not apply to service requests or emails from residents who comment on public policy matters that relate to the operation of municipal government. This very short introduction, and I thank you for your attention, and I'll turn the program over to Vice Chair Jordan.
I'm pleased to bring you the third priority issue recommended by the MML Legislative Committee. As cellular data usage continues to rise, carriers are looking to expand and strengthen their networks. The recent trend shows cellular providers moving towards the use of distributed antenna systems, known as DAS, and small cells to fill holes in their networks and increase capacity. Small cells are different from traditional macro cell towers in that, as the name suggests, they're much smaller, like an antenna and support equipment on a telephone or light pole. But these DAS must be deployed in greater quantities because their range is measured in feet or city blocks, not in miles. Many of you have encountered companies that install cellular infrastructure to be used by major cellular companies and carriers. The nexus between these small cells and municipalities occurs when the placement site is on municipally owned property or in a municipal right-of-way, which is a common request. To some extent, federal law allows for state and local authority to control placement of these antennae and manage right-of-ways, subject to some limitations. Many municipalities review siting applications and make decisions on the installation of small cell antennas. However, because there's no state law in place to mandate that municipalities have oversight over the location of this infrastructure in the future, the local authority to site small cell infrastructure could be challenged in Maryland. It's recommended, the Legislative Committee, it's our recommendation to pursue legislation and advocate to secure the authority municipalities to review and authorize the siting of small cell infrastructure in their jurisdictions. So with that, I thank you for your attention. We're concerned about the cell phone tower antennas, small cell towers. There are companies kind of coming into our municipalities now, and they're putting up antenna for cell phone signals. So this is something, we need control over our right-of-ways, and we need to be able to regulate these towers. If somebody wants to come in and put a 100 or 1,000-foot tower in our city, we need a say in that. And if there are impacts, we need to have a fee to mitigate that. So that's another crucial legislative initiative that we're very, very concerned and passionate about.
The cell tower issue is coming up, and the Legislative Committee has made that one of their priorities this year as well. Where these cell towers go, they're asking to be able to go in the public right-of-way, which puts them in front of homes and along sidewalks and whatnot. They're large structures. They have no business being in front of homes, in my personal opinion, but this is a topic that the Legislative Committee is taking up and going to work with all the municipalities in the state to find a solution that helps everybody. So yeah, I think that's a big one.
A lot of small municipalities in the state of Maryland are relatively small, 6,000 or less. A lot of these towns are having a problem with their downtowns, the old downtown. We're in the process of trying to renovate our downtown, and we're looking for the state to assist us with possible grants and funding to help restore the great downtown of a lot of these older municipalities. To bring in more stores, more restaurants, more entertainment for the residents.
One of the great things that the Maryland Municipal League does is it activates our municipal officials and our municipal residents to understand that they've got to interact with county, state, and federal folks as well, because we're all in this together. And government is complicated. It's not just one level of government does this and one level of government does that. They work together to fund things, to budget for things, to regulate things, and they need to be working together on all of these priorities. And so MML helps train and educate our municipal leaders throughout the state to understand the importance of being involved in Annapolis, being involved with their state legislators and with the governor's administration to protect the priorities of our residents.
Advocacy being the number one priority of the Maryland Municipal League in our mission is primarily focused on state of Maryland advocacy. So we really focus our time and our staff's time on advocating before the Maryland General Assembly. And as you know, we have a 90-day municipal or 90-day legislative session. And during those 90 days, it's very intense. And we're trying to get bills passed that are effective for municipal government. We're also trying to stymie bad bills that get introduced every year. And last year, for instance, there were 2,800 bills that were introduced in the Maryland General Assembly in that 90-day period. We were lucky and happy to say that there were 71 bills where really had municipal implication that we took a position on, and of those 71 bills, only one passed that we opposed. Only one. And even that bill was amended significantly. But Maryland Municipal League also partners with our colleagues in Washington so that we have effective advocacy before our congressional delegation. We work with the National League of Cities. And Maryland being an affiliate of the National League of Cities, we're actively involved. And fortunately for us, being so close to D.C., we can go to Washington pretty much any time to talk about the issues that are important to Marylanders.
This workshop this morning deals with advocacy, and I love to come and talk to this group because it is so important to build a relationship with your legislators, and when you've got an issue, then you can come and explain your issue. You've got somebody that you know that you can talk to and get your point across, and it's really about the best way to get legislation passed.
Clearly they need to speak to the legislature about their particular issues. In the last decade or so, they've had a lot of issues with restoring highway user revenues, and it's really important for them to be able to tell their stories directly to those who are making the decisions. And it's also really important for them to be able to tell their stories to people like me who are members of the press who want to be able to explain the budget realities to readers.
It's a way to reach out to get your message across, and it's there's many ways to do that, and the media is one way, direct contact with people is another way, and social media is another more efficient way.
We rely on our local municipal officials to help us do our job better. If we don't hear from you, we're making decisions in the dark. So we need you all to give us specific reasons, facts about the implications of legislative proposals. How would it affect our local communities? You need to be in touch with us often. You're never bothering us. Email us, text us, call us, but definitely make sure you're reaching us personally.
In my committee, Economic Matters, we're 22 members, and the goal is to try to either pass a bill or kill a bill. We need very concise information. We hear so many bills during the day, and many times what makes the day is local officials willing to come to Annapolis, share a personal story. That's much different than saying a lobbyist presenting the dry bones, why it needs to be passed or killed. So it changes the dynamic of what we're listening to and how we can relate to one another when we're voting for or against a bill.
Education of local officials is very, very important to the continuation of municipal government. You know, I remind people a lot that they have to take into consideration that people get elected to municipal office probably as the first elected office they've ever held. So things like public information laws, things about how to run an effective meeting, parliamentary procedure, those items which are very important to the effective running of municipal governments, people have had no experience with. So we have to, as their association, take the time to train them on the proper aspects of being a good municipal official, making sure they're ethical. We have classes on ethics. We have classes on municipal budgeting. So the education component, particularly at the municipal level, is probably the most important thing that we do.
I'm a first-time mayor. I've been in office for 5 months, and I came here so that I can learn more about funding and state highway and how the league can help us thrive, our town thrive.
How valuable have these educational sessions been for you?
Oh, very valuable. I have learned so much. I went to the summer MML, and of course I'm here now, and I don't think we ever stop learning.
It's always great to come to the conferences and learn, hear other people, and learn about all the different programs that MML does offer, and that's been a great asset for us.
It's hard to put a value on the educational component of MML because it's not only just workshops that you're getting educated or actually in the academy courses where there's an actual instruction going on, but you're actually getting the networking, and that's really the education of MML, is the sharing of best practices, the conversations you have with other elected officials, and sharing problems and sharing solutions.
I was just elected this past May as a new council member for Tawny Town, and these conferences have really given me a basis, and a stepping stone. I don't think I could have half as much information and have made quite as many networking opportunities as they offer you here at the conferences, and the experience offered by all of the individuals who have been doing this for so many years has been instrumental in all of the knowledge that I now have. Learning from experience is a good thing, but if you can go in with all your homework already done, then it makes it that much better.
I've been attending these conferences for over 30 years, and I would say the bedrock of what I've learned as a municipal official has been gained from events just like this. The broad array of speakers, the experts in the field, have been a tremendous benefit to us over the course of time. And I don't know how you'd ever put a dollar figure on the amount of knowledge that we've gained. If we would have had to hire consultants or attended independent seminars or workshops, it would have been completely impossible to get to where we are today. It's been essential, I guess is the best way to say it. Without these conferences, I don't know how we would get the information we need to operate our cities.
Welcome to the workshop addressing the opiate crisis.
I'm going to set the stage a little bit and start by talking about the epidemic itself and its scale. And then I'm going to spend a little bit of time detailing some of the strategies that Baltimore City has put into place to combat the epidemic, strategies that you see mirrored at the state level here in Maryland and really across the country. So I called the opioid epidemic an epidemic, and it really is just that. Last year, in 2016, we think there were about 64,000 deaths due to overdose nationally, and the great majority of those overdose deaths are opioid related. So here in Maryland, there were more than 2,000. There were 2,089 deaths. And in Baltimore City, which represents about a tenth of the state's population, there were 694 overdose deaths. And again, the vast majority of those overdose deaths are attributable to opioids, like prescription painkillers or heroin. Now, these numbers are so big that I think it's hard to kind of get a handle on them and to think about what that really means. So I want to make two contextualizing points. The first is that these numbers are way bigger than they used to be. They've gone up dramatically. There are 4 times as many overdose deaths now, nationally, than in 1999, less than 20 years ago. 4 times as many. If you look at the local numbers, in Baltimore City, the number of overdoses doubled in 2 years, between 2014 and 2016. And the same was true at the state level. There were just over 1,000 or so overdose deaths in Maryland in 2014, and like I said, there were 2,089 last year. In Baltimore, the 2016 number, it's triple what it was in 2012. So between 2012, 2014, and 2016, you have overdose deaths tripling in Baltimore City. I think it's worth pausing really briefly to ask why this is happening. And of course, we could spend a lot of time talking about that. Broadly, what you'll hear correctly is that a great deal of this is attributable to our prescription practices in America. It's no coincidence, I think, that since 1999, just as the number of overdose deaths has quadrupled, the number of prescriptions we write for painkillers has tripled or quadrupled, depending on where you are. There has been some progress made in this area. It looks like prescription rates, well, they have plateaued over the last couple years, but they've done just that. They've plateaued. And they've plateaued at a level that, again, is 3 to 4 times higher than it was 20 years ago, and 3 times higher than it is right now in Europe, where presumably people feel roughly the same amount of pain as they do in the States. And then more recently, over just the last couple years, and especially here in Baltimore and in Maryland, we have sort of an intensification of the epidemic due to a synthetic opioid called fentanyl. I'm sure many of you, if not all of you, have heard of fentanyl. It's made very cheaply and easily in labs, often in China or in Mexico, and shipped into the country illegally, but it arrives at JFK, is shipped through the post office. Fentanyl does have licit medical uses, but most of the overdose deaths that we see resulting from fentanyl, that fentanyl was made for illicit sale. So to give you a sense of what's been happening specifically with fentanyl, in Baltimore City in 2012, there were 4 deaths that were fentanyl related. 4. Last year, there were 419. And it looks like, based on the preliminary data from 2017, that fentanyl is now going to be responsible for more overdose deaths than any other single drug, including heroin, which is really scary. Where does all of this leave us? And this is my second contextualizing point. When I say there were 64,000 deaths last year, I think it's important to acknowledge that that's more deaths than were attributable to car accidents, to HIV, to guns, and that's during the height of those respective epidemics. So more people now die of overdose than ever died in a single year of car accidents or HIV. It's now the leading cause of death for Americans under 50 years old. And it's actually contributing, it looks like, to a decline in average life expectancy for certain groups in America, which is, I think, the doctors can correct me, but I think just about unprecedented in America's recent history. And shadowing all of this, all of these really upsetting numbers, is that for each person who dies of an overdose, there are many more struggling with dependence or addiction. The number you'll hear sometimes is that there are 2.5, 2.6 million Americans with opioid use disorder, and based on the number of Americans admitted into emergency rooms for opioid-related reasons, that's probably actually an underestimate. So we're talking about millions and millions of people. And it's having effects across the country, not just for those individuals and their friends and family, although of course that is paramount, but for the economy. So there's been recent work suggesting that the opioid epidemic is actually contributing to a decline in labor force participation among, so-called prime age men. So that is the epidemic in a nutshell. Now, a little bit more positively now, I want to talk about some things that we are doing and that look really promising and that we can continue to do in Baltimore and Maryland and across the country. So in the city of Baltimore, under the leadership of our health commissioner, it's an amazing doctor named Lena Wen, we have a three-pronged strategy for combating this epidemic. The first prong is to save lives with naloxone or Narcan. The second is to expand access to long-term treatment for addiction. And the third is education and outreach, especially education to destigmatize addiction and its treatment. So I want to focus on three initiatives within the first two prongs. So talking about naloxone and talking about treatment. Naloxone, sometimes called Narcan, for those of you who don't know, it's an antidote. It is, as our health commissioner says, one of the few antidotes in modern medicine. So it's a medication that reverses an opioid overdose, reverses the respiratory arrest, and saves someone's life. In 2015, 2 years ago, Dr. Wen issued a standing order for the city of Baltimore, basically a blanket prescription for all 620,000 residents. So she was the prescribing doctor, and everyone could get naloxone or Narcan with a simple training. And actually now, as of this past summer, across the state of Maryland, anyone can go to a pharmacy and get naloxone or Narcan even without the little training certificate. So it's effectively available over the counter, which is wonderful because it's extremely easy to use. I'm not a doctor, but I understand that there are a few serious side effects, if any, and again, it can save a life. And the numbers in Baltimore really testify to that. So since Dr. Wen issued that standing order that I just mentioned in 2015, we've trained 28,500 of our residents to use Narcan or naloxone, to recognize an overdose and then use it to save a life. We've given out just south of 26,000 kits. And these residents we've trained, who are everyday residents, this doesn't include our first responders who are also doing great work. These everyday residents have saved more than 1,300 lives since 2015. They've reversed 1,361 overdoses, which we're really proud of. And I think, again, testifies to the importance of expanding access to naloxone. Particularly important for us is getting naloxone into those most vulnerable populations, the populations who are most at risk for overdose death. So in Baltimore, that means the clients we're serving on our needle exchange van and areas of the city that have recently experienced spikes in overdoses. So at the end of each day, our first responders, EMS, they tell us how many overdoses they responded to, how many lives they saved, and the numbers are scarily high, 15, 20, 30, 35 every single day. And when they're particularly high, when there's a spike in a single area for overdose deaths, that's where our outreach team goes, to talk about treatment, to talk about naloxone, and to give it out for those who might need it. Now I want to talk about treatment. The opioid epidemic it's tragic, of course, but it's particularly tragic because addiction is a disease and treatment for that disease exists. And so recovery is possible. There are 3 FDA-approved medications for treating opioid addiction. So there's naltrexone or Vivitrol, which is the newest. There's buprenorphine, sometimes you'll hear Suboxone. And then there's methadone, which is the oldest. And medication-assisted treatment, so treatment that uses these FDA-approved medications, it really works. It works quite well. Compared against placebo or just therapy or counseling alone, you have greater reductions in illicit drug use, longer retention in treatment, so people stay engaged for a longer period of time. And then probably most importantly, you have a lower mortality rate, both overdose-related and all-cause. People are just less likely to die. This treatment, it saves lives. And yet, in part because of the stigma that attaches to medication-assisted treatment in particular, across the country, only 1 in 10 people who need treatment actually get it. Luckily, there's a lot that can be done to address that, to expand access to treatment. And I want to talk about 2 things really briefly. So one, Baltimore and Maryland actually sort of simultaneously are pursuing different strategies for identifying where treatment is right now. So if you're someone who is struggling with dependence or addiction and you decide that you want to stop, that you want to get help, that you want to go into treatment, that can be a fleeting moment, that moment of courage. And so it's really important that people don't call the state hotline or call the city hotline and get told, yeah, we do have treatment available, but in 4 days. Because we don't know how that person will be feeling in 4 days. So what we're doing at the city level is starting a pilot to track real-time capacity. So that we can say at any given provider in the city, they have 3 beds available, they have 7 beds available for this kind of treatment, for that kind of treatment, so that we can send people exactly where treatment is available right now. The next initiative and the final thing I want to talk about, which I think is extremely important, is to try to bring treatment to those who need it to the extent possible. This is one of the motivating principles of the Baltimore City Health Department. We go to where people are. And there are a lot of people in our hospitals suffering from opioid use disorder who are not connected to treatment for that opioid use disorder. They're not getting the help that they need. So 2 things that are really promising that you're starting to see around the country. One is a program that in Baltimore we call the Overdose Survivors Outreach Program. So in short, if you come into an emergency room in the city and you've survived an overdose, you're connected with a peer, someone who is themselves in recovery, who works with you, speaks with you, and tries to connect you with treatment out in the community so that you have a warm handoff. You're not just handed a name on a piece of paper or the number for that hotline I mentioned. There's actually someone in the flesh to guide you there. But there's something else that can be done that's sort of one step better than this warm handoff, which is, in essence, no handoff at all. So one of those medications I mentioned, in particular, buprenorphine, also called Suboxone, it can be prescribed like any other medication, unlike methadone, which is more tightly controlled for sort of a couple of different reasons, some historical. And that means that buprenorphine treatment can get started. So there can be buprenorphine induction, it's called, right in the hospital. And that's something we're starting to do more and more at Baltimore City's hospitals. So someone comes in, they've overdosed, we know that they're in need of treatment, we know that they have opioid use disorder. So one, instead of just giving them a name or a number, we should have a person there, a warm handoff. And then beyond that, if we can, we should start treatment right there. And these are things that could be implemented anywhere, right? They don't necessarily cost money for municipalities, for counties. Buprenorphine is a medication. You can bill insurance. You can bill Medicaid. It's just a question of getting the right people to the table, helping them see that this really is an epidemic and that this is a service they should be offering.
I'm approaching this from a health care system perspective, and I think the first step is that healthcare providers acknowledge and recognize their role in the epidemic, and we have done that at KP Mass, who I represent Kaiser Permanente, and then once we've recognized that role, we actually approach this from every angle, from prevention of another generation of members, patients, the population becoming addicted to opiates, and also really providing comprehensive treatment of pain and of addiction. And as Evan Burrell mentioned, also harm reduction strategies are really critical, and the healthcare system does provide a role in that harm reduction as well by prescribing naloxone more regularly and making it easy for patients to access naloxone.
It's a wonderful conference. I just addressed the orientation for folks who have never attended a fall conference before, and the room was packed. And that's a great sign that people really are engaged in the Maryland Municipal League. Not only the ones who've been engaged in the past, but a whole nother generation of folks are understanding the value of this organization and want to participate and be active.
Without a doubt, it has been the largest resource that I have had. The MML allows me to tap into their website to make phone calls with quick returns. Obviously, networking with all of my colleagues from across the state has a huge benefit. I'm very thankful for this conference and the other ones to come.
Local government is closest to the people. We're the ones that directly affect our residents' quality of life. But please know that your elected and appointed officials in your towns are very transparent in our operations and are always very willing to listen to our residents to go ahead and improve their quality of life.
Local government is a very, very special and important part of government operations in the state of Maryland. Yes, we have the state government, we have the county government, we have the municipal government. But guess what? We're all partners. We're all in this together. We all serve the same constituents. So it's really important for people to understand that in our world, we're all working together, and as long as we share, as long as we partner, we can do major service to the citizens of our state.
It's the government that's closest to the people, and if our municipal government doesn't have the confidence of our citizens, then we have a big problem as a state. And we have to show our voters and our citizens that we can get the little things done right. They're not little, but things that matter to them, picking up the garbage, fixing the potholes, taking care of the city budget, municipal budgets. If we can't get their confidence on those at that level, it's very hard to get it at the state level when we're asking for big changes, for example, in public policy.
I really came by to just thank all of the municipal leaders, the mayors here today, for all the incredible work that they do in their communities and for the great relationship that we've had working together with them. I told them that the work that they do is critically important, sometimes underappreciated, and they don't get the appreciation and the recognition that they deserve, but they're really critical, and the local government is the closest to the people, and I just thank them all for the work they're doing and for the great relationship that MML has had with us.
If people have questions, like more information, what should they do?
They can go to the Maryland Municipal League website, and that's mdmunicipal, one word, .org.